Breast cancer is generally divided into 4 stages: stage 1, 2, 3, and 4. In general, stages 1 to 3 are curable, and stage 4 means that the cancer has spread beyond the breast to other parts of the body, including the brain, the lung, the bone, and the liver. These are the usual common areas of spread by the cancer. For early stages, the cancer is usually treated with surgery, where the lump is surgically removed, along with any lymph nodes that may be present in the armpit area. How do we know what type of stage breast cancer is? We may do additional imaging such as chest x-ray, an ultrasound, a bone scan, or sometimes a CT scan of the whole body. This way we would know the depth of the invasion by the cancer into the chest wall of a patient. And for stage 4, we do not recommend any surgical excision because the lump being present in other parts of the body, if the breast one is removed, the other cancers are still not cured. Therefore, we do not recommend that. Breast cancer in general is treated by 3 modalities. These include surgery, chemotherapy, and radiation therapy. Surgery is the surgical removal of the lump in the operating theater by a breast surgeon, and this will completely remove the lump from the body. Stages of the cancer may be slightly more advanced, like stage 2 or 3. We do recommend patients to have chemotherapy. The aim of this chemotherapy is to decrease the chance of a relapse by the cancer in, let's say, 5 or 10 years' time. After removal of the tumor by surgery, the risk is much less, but the addition of the chemotherapy will decrease this risk even further. In some patients who only have a partial mastectomy, where only part of the breast is removed, radiation therapy is recommended to treat the remaining breast tissue that is left behind in case there's any cancer cells at the margins. For stage 4 cancers, we generally treat with chemotherapy alone. Chemotherapy is generally an infusion of medicine that goes into the vein of the patient, and this can generally be given either in 1 week or 2 weeks or a few cycles. At the end of the breast cancer journey, this is not the end of the road, and we do encourage patients to return to their daily activities as best as they can. Most of them could return to work, and we also encourage patients to go for regular exercises and to resume healthy diet with less red meat and more fruits and vegetables. Do practice self-palpation of the breast every day. In addition to seeing the doctor every few months for physical examination, patient will also be required to perform a mammogram once every year. Some patients will want to have a hormonal therapy. We call it an anti-hormone treatment. Serves to reduce the cancer recurrence, and patients generally stay on this for about 5 years. Again, this is Dr. Seong from International Cancer Specialists. I hope my sharing will provide you with some insights on breast cancer and how we go about detecting and treating it. I'd like to wish you all good health and have a good day. Thank you.